A hearty good afternoon and welcome to the session of Diet on PCOS. We are glad to have Dr. Pratibha Pasari among us today to help us understand the topic. Polycystic ovary syndrome (PCOS) is a common health condition experienced by 1 out of 10 women of childbearing age. Some research has shown that diet can help reduce the impact of PCOS. Dr. Pratibha will take us through that and more in this session today. Doctor, you have the stage.
Thank you so much. Thank you. Hey, very good afternoon. Today I'm here to speak on diet in PCOS. Whenever a patient is diagnosed with PCOS in my clinic, I always explain them about the diet and what is the impact of diet on PCOS and how diet helps to regulate the PCOS. For that, first let us go in deep about what is PCOS so that we understand how diet helps in reducing the PCOS. So, PCOS is a condition uh, where the ovaries are large, the ovaries produce immature or partially mature eggs, which becomes like cyst in the ovaries, and they produce large amount of male hormones. In a female body there is a balance between male hormone and female hormone, where the female hormone is more and we have minimal of male hormones. But in PCOS, the male hormone production is increased, for which the signs and symptoms of PCOS are all due to increase in male hormones, and the ratio between the male hormone and the female hormone is altered. So PCOS is basically a hormonal condition. So, PCOS is the short form of polycystic ovarian syndrome. Now, some may ask, then what is PCOD? Like PCOD, earlier we used to say it as PCOD. PCOD is polycystic ovarian disease. And now we call it as PCOS, that is polycystic ovarian syndrome. Because earlier it was believed that the condition is limited only to the ovaries. But as now we have gone in details about in the research in details about PCOS, we have now seen that the increase in male hormone is responsible for other conditions in other places in the body. So this is a condition which starts early in life, but it has an impact later in life, which will give rise to other associated conditions like the heart diseases, the liver diseases, diabetes, hypertension, infertility, and many other diseases. So, if we take care of PCOD early in our life, we are able to prevent these diseases later in our life. So, one may ask, what is the cause of PCOS or PCOD? So, the cause is exactly not known. It may be due to insulin resistance. Insulin, again, is a hormone which we all know is responsible for diabetes. So, when the body is resistant to this insulin hormone, there is an increase in these male hormones in the body. And this male hormone is again responsible for all the signs and symptoms of PCOS. Overweight or obesity is also related to PCOS. If a person is overweight or is obese, then they have PCOD, and there's a vicious cycle obesity give rise to PCOD, and PCOD will again give rise to increase in weight. So again, when we are watching our diet, we also need to have a control on our weight also. So diet and lifestyle modification goes hand in hand when we are going for the management of PCOS, and I'll explain that later. And another cause, it may be genetic. So as such, actual cause is not known, but there may be certain factors which are related to development of this PCOS in the body. How do you say that? How is the PCOS diagnosed in your body? So when you visit a doctor, if you have two out of these three criteria, like number one is anovulation, that is your ovaries are not ovulating eggs. Number two, hyperandrogenism, that is increase in male hormones in your body. And if your sonography shows the PCOS appearance, the polycystic ovarians in the ovaries, then you are said to have PCOS. And when you are said to have PCOS, you need to take care of it. So it is not a disease where there is any medication or any surgery needed to control this disease. It is totally dependent on diet and lifestyle modification, and then maybe medications later. So primarily it is the diet and lifestyle modification which needs to be taken care of. So the PCOS diet is very, very, very important. A person who is having PCOS should keep in mind certain things, like they should have a diet with low glycemic index. What is a low glycemic index food? Now, when you go and search in Google, you get a whole lot of list of low glycemic index foods. You can select from them. If you're vegetarian, you select the vegetarian foods. If you're a non-vegetarian, you select the non-vegetarian foods. You make a list of it, which food suits you. So you take all those non-glycemic, low glycemic index food. Then food which are anti-inflammatory. Now, which food are anti-inflammatory? The food our Indian spices. Indian spices are good anti-inflammatory food, like cumin, cinnamon, cloves, turmeric. All these are very good anti-inflammatory foods. Then you should have carbohydrates like refined. You should not have any refined carbohydrate. You should always go for unrefined carbohydrates. You should use whole wheat instead of using maida. Then fruits. In fruits, you should have fruits with high antioxidants like grapes and berries and cranberries, avocados. Like these are very good food for PCOS. Then again, in vegetables, spinach, broccoli, all green leafy vegetables have good amount of antioxidant. So any other locally available vegetable, green leafy vegetable also, you can go for it. Then yeah, they say that you can have some dark chocolate in moderation, which helps PCOS. So good thing is that you can have a little bit of dark chocolate in moderation. Now, what you cannot have is, as I said, refined sugars. You cannot have all those maida, sugar, and the fast food nowadays is made up of this maida, like pizza, burger. You should avoid all these things. And when you are going to a pizza and burger, you have that carbonated drinks along with it. So you should avoid those carbonated drinks also. Go for good meat, like red meat. You should go for it. And if you're a non-vegetarian, but in PCOS, there is one thing to be kept in mind is the plate model. In PCOS, there is a plate model. In that plate model, what you do is you do divisions of your food in your plate. In the plate, you make two divisions, one half and second half. So, and of the second half, you make another two divisions. So you have total two divisions, one half and one quarter and another quarter. So this one half should be of fruits and vegetables. Vegetables may be raw, may be cooked, then fruits of your choice. Then again, the quarter, one quarter should you should have carbohydrates, and that too, as I said, unrefined carbohydrates. And the other half, other quarter, I mean, it should be made up of proteins. And proteins also, you should not be taking meat which has a high content of fat or fishes. So you should keep a watch of the fat content or the carbohydrate content in all your food. Go for low glycemic index foods. So this is the plate model which you should always keep in mind. So more of fruits and vegetables, then proteins, and less of carbohydrates. So if you keep this in mind, PCOS, you will definitely get cured your PCOS. Then again, as I said, that lifestyle modifications should go hand in hand with diet. It's not that you're following diet and your PCOS will be reversed. It's not that. And one thing you should always keep in mind, that PCOS is a condition which will not go off completely, and it will take years, maybe months or years. Some it may take months, and in some it may take years to reverse the process. So you should be consistent with what you are doing with your diet and with your lifestyle modification. So in your lifestyle modification, as I said, that PCOS is related to obesity. So you should always watch your weight. Number one, watch your weight with the diet. and number two, exercise. So the ideal BMI is 18 to 24.9. So you should try to keep your BMI between 18 to 24.9. More than 24.9 is overweight, and more than 30 is obesity. So BMI you can always calculate in Google. You see there is a formula with height and weight. Calculate your BMI and try to keep your BMI within the optimum level. uh, you need to do some exercises, not very hard cardio or something, but 20 to 30 minutes of brisk walk in the morning is good enough for you to take care of your PCOS. So do a morning walk, brisk morning walk, 20 to 30 minutes a day, and maybe 5 times a week are enough. You can take off on your Saturdays and Sundays. Another 5 days of the week, you can go for walk. So, if you are able to keep these things in mind about the diet and lifestyle modification, your PCOS will be reversed, and the condition will not be taken care of completely, but the impact of it will be lowered. The condition which is started, it will not lead to other associated conditions which you may get later in your life. As I mentioned, diabetes, hypertension, heart disease, infertility. This are taken care of. So PCOD is a self-limiting condition. If you take care of your diet and lifestyle, it is a self-limiting condition. But if you have other problems which are not the symptoms of PCOS, like you are having menstrual irregularity or skin problems or infertility. So if your PCOD is reversed, these problems will be taken care of. If you lose your weight in 3 months of time, you will have your menstruation will become regular. And yeah, one more thing about in weight loss is, uh, uh, if you lose 5 to 10% of your ideal body weight, say if your weight is 60 kg, if you lose 6 kgs of your body weight, then your PCOS condition will reverse slowly and gradually. Keep this in mind. 5 to 10% of your body weight you should lose, and take care of the diet, as I said. That will help you to reverse the condition. And as I was saying, if you are having any other problem which you is not taken care of by even by doing these things, then you should visit a gynecologist, tell your problems, and then that will be taken care of. Thank you so much. Any questions I would like to answer? Do we have any questions? If not, you may ask the question later on. Contact us and I will reply to your questions. Thank you so much.